I'm Dee. I'm a certified lactation counselor and a doula. If it's your first time here, welcome. If you are returning subscriber, thank you for coming back. Today I'm answering your questions about breastfeeding. If you have more questions, please let me know. If you have any encouragement for mamas to be, parents to be, please leave them in the comments, or any advice at all. I'd love to hear from you all. So let's get right into it. The first question is, why some children don't eat after exclusive breastfeeding? That was the first question I got. So culturally, even when I had a baby, I heard this over and over, that if you exclusively breastfeed your child, when you give them food, they will not eat. And I think this is mainly stemmed from the fact that we compare a child who is being exclusively breastfed to a child who has been eating since 4 months, or who has been eating since 3 months in some cases. And so of course that child by now would have been used to eating those foods that has been fed to them. And then our child who is yet to learn, we take it as they are not eating. But there's a really huge learning phase which is all important. Once your child is ready to eat, it's really important that you give them that chance to play with food. Food before one, like they say, is just for fun. So your child is learning coordination, hand-mouth coordination. Your child is still practicing chewing and all that. So it's not that they do not eat. It's just that they are learning, and we are comparing to another child that has already learned. The truth though is that in the long run, the child who was exclusively breastfed and was allowed to eat when they were ready would do better in terms of eating compared to the child that was forced to eat. And so that's something we have to pay attention to. If your child though is not eating, like, that is a health concern that needs to be investigated through tests and seeing a specialist. But this question, I know so much culturally that we believe if the child breastfeed, then they will not eat food. I think that we expect that as soon as, but by the time the mother has gone through exclusive breastfeeding, they are so tired, they are ready to be done. And then now they give the child food, they expect the child to gobble it up, and the child is throwing, and they're like, why is he not eating? Supposed to, but the child will take some months to practice and to, you know, play with the food, and they do not really need to. They're still getting nutrition from you. And that's why I always advise mothers, when you start solids, always offer breast milk first or formula first, because they're still getting their nutrition from that breast milk or formula, and then you are slowly going to transition to solid. Also make sure that your child has met all the requirement to start solids, because we assume that the child is ready to eat just because we hear 6 months the child has to eat, we immediately start giving them food. That is not the case. Of course, it's going to be different if the child has some developmental issues, and I'm going to address that as well. So let's go to the next question. It says, how can we ease a painful latch? And the person put in brackets, no lip or tongue tie. So if your child, you are having a painful latch, I want to tell you it's not normal. Breastfeeding shouldn't be painful. Breastfeeding shouldn't result in wounds and sores. For a long time, we've believed that, oh yeah, it's gonna be painful and then it's gonna stop. If your latch is painful, you wanna release that latch and you wanna try latching the baby again. Now you wanna look at your baby. Is your baby in a good position for latching? I think the next video I'm going to make is to show you step by step how to attach your baby to breast. So one key thing that you can always look out for is that baby's ear, shoulders, and hip are aligned. So you don't want to hold the baby facing like this and you're trying to put the breast in the baby's mouth. That will make it really hard for them to latch on the breast. Another thing also is to make sure that their chin is touching your breast, and their nose is also close to your breast. So if the child is so far away from the breast, it makes it hard for them to create that touch, that that formation on the areola so that they can take in the breast as much as possible. I think it's called the teeth. They have to create these teeth around the breast. And so mainly when the latch is painful is because the baby is not latched on it properly, and they are compensating with their mouth like, this thing is not entering my mouth properly. I'll go into detail step by step how to latch a baby. Another thing I want to address also is that there have been many cases where a pediatrician will tell a mom, oh, your baby has no tongue tie or lip tie here. But then when the mother gets a second opinion from a lactation consultant, they realize that the child has a lip or tongue tie. Pediatricians, some pediatricians are not trained. Most of them are not trained in identifying tongue ties. So you want to make sure that you are seeing someone that knows and can identify tongue ties. And of course, proper latch. And the next question here is, how can we encourage babies to eat until satiated and not simply fall asleep on mom only to request milk 45 minutes later? So this depends on the baby's age. If you have a newborn, 1 day, 2 days old, they can eat every 45 minutes. I know. It's normal, but it's not normal to us because what? I thought I'm just gonna have my baby and I'm done. What is this now? So a baby can request milk, especially newborn, 1 day or 2 day old. They can ask for milk frequently, like every hour, every 2 hours, or just stay on the boob. I know they sometimes tell us that, oh, we feed every 2 hours or every 3 hours. When the baby is new, they can eat all the time. That is because their tummy is the size of a marble, not the size of a marble, but about the size of a marble. 2 teaspoons will fill their tummy. So you can imagine, so it fills up fast, it burns fast, and then they want more. And this is something that if you are a new mom or you are pregnant, you have to be preparing yourself for. That baby will feed frequently. The first week and the 6th week can really be crazy for mom, because that's when baby will want to, there's normally a growth spurt and baby is asking for more and more. And they are just telling your body, they are putting in the order for milk so that your body makes more milk for them. The more they remove, the more your body makes. So this is all something that naturally has to occur so that you can produce the milk that your baby needs. But if you have passed, you feel like your baby is just falling asleep, they are not eating at all, okay, your breast is not empty, they just do not finish sucking and then they fall asleep. To keep your baby awake when they are sucking, you can just be moving their cheeks. You can sometimes strip them before you breastfeed them. Sometimes you can, if they are falling, it's time to eat and you see they are falling asleep, you can hold them up like that, and then that can wake them up. But if you try all that and they still sleep, then you just have to feed them in the 45 minutes when they wake up. The important thing is that they are waking up to feed. Maybe that's how they want to feed, and I know that can be hard on mother, but if they are waking up to feed, they are gaining weight, there's no pain, then that is just newborn baby vibes right there. Okay, and the next question is, how do we keep up with feeding and pumping after 6 months? And the person put in bracket, at 6 months, I'm done. Lol. I pump a year's supply and I slowly back away. It can be exhausting. Pumping is exhausting. I mean, breastfeeding is exhausting. So this is totally okay. If these are your breastfeeding goals, then you are successful. A lot of people do this where they pump, maybe they pump for a year, they breastfeed to maybe 6 months, and then they stop the breast and they start taking from the fridge or freezer. And then once the freezer or fridge starch is done, they are also done. They win and they just, go fully to. So if that is your breastfeeding goals, then you are okay. You are done with that. But when it comes to, if you want to continue breastfeeding, some of the things that I will advise is just really support. Support, support, support. If you can get somebody to come in and do some of the things for you around the house so that you can rest with your baby, that helps so much. Skin to skin with your baby. If you are feeling touched out, I'm breastfeeding a 2.5-year-old. Some days I'm like, I don't want anyone to touch me. Like, don't touch my breast. And so in those days, I would just take some time off, do some things I enjoy, go out, take a walk, just take a break from doing things. It's just exhaustion. So when I rest and I do things apart from things I do usually in the home, it really helps me to just come back and continue. But like I said, if these are your breastfeeding goals, then you are okay. You can but with exhaustion, is rest and support. If you have support, if you have community, take advantage of them. And then the next question is best natural nipple cream. The best natural nipple cream, it's your breast milk. It's amazing, right? Right there, you don't need to buy. So you put your breast milk on your nipple, and then you let it air dry in between breastfeeding, and that is really good for healing any nipple trauma or any soreness. And then the next one is why the need or advocate for exclusive breastfeeding. That is because a lot of people still have not been informed about the fact that breastfeeding is baby's food. A lot of us grew up thinking it's just something optional, but breast milk is actually baby's food. And when you introduce any other thing, you are potentially introducing contaminants. You are potentially introducing something that can harm the baby. We advise formula because it is medically necessary for some babies. We always choose the baby and the mom. Okay, so we want baby alive, we want baby healthy. So if it's medically necessary, then formula is definitely what we would ask the mother to give. Before formula, what we can do here in the United States is donor milk. So because I went straight to formula, because I do know that, especially with my audience back home, that we have not yet established that donor milk situation yet. I hope one day it will be something that we have formally, and people know about it and how to go about it. But here, your first option, if you do not have any milk to do exclusive breast milk, and for any reason you do not have breast milk, the second option is donor milk, and then there is formula. And then the next question, are all babies supposed to have exclusive breastfeeding? I'm not talking about cases where mom has some complications and cannot breastfeed. I'm talking about when baby is small and breastfeeding is not enough. So when there is a situation, and we do have those situations where we've tried all the interventions, pumping, extra pumping, feeding, double feeding, triple feeding, and then still we are not getting the milk that we need to give, then yes, we will try and do donor milk. And if that we don't have that, then formula will be what we will give to the baby. So yeah, there can be cases where the mother cannot make breast milk, or they are making and then they cannot make any more. And then this one is not a question. The person just said, I never had any breast milk. So I have gotten this one most of the time. Like people will go like, my milk never came in. So your milk is there from 16 weeks pregnancy. When you are pregnant at 16 weeks, your milk start coming in. So your milk is there. And if you look at your breast, there will be some breast changes. You feel some tenderness. You feel like your breast is full. You feel some sensations. Those are all signs that there is something taking place and your milk is right there. Even at some stage, you can press your nipple and you will see your milk leaking. So for most people, they do have milk. We have, of course, the rare cases where a person cannot make milk, which is about 3% of women who cannot make milk. So what happens is that there are stages of breast milk making. The first stage is the 16 weeks where you already have milk. The colostrum is already there waiting for your baby. When your baby comes, the colostrum is already there, done deal. You have to remove the milk. Your baby has to eat, or you have to remove the milk so that the second stage, you are putting in order for the second stage. Breast milk is all about demand and supply. So when there is anything that interrupt that first day, second day, your baby is not latching, and you do not get support to express with your hand. Sometimes people use the breast pump and then nothing comes out because colostrum is really sticky and it just drop. Like if you use a pump, you might feel like there's nothing in here. So a lot of people miss out on that first day, second day, and that can delay, or that can make the next phase of breast milk production slower. So you might not be seeing enough milk, and then people will introduce formula, which in turn fills your baby. And then when you don't pump or you don't remove milk, you are continuing to tell your body that I do not need milk, and then eventually you might dry up because your body will stop making milk because there's no removal of milk. Another thing that is really common is if you had a C-section, you had epidural, you had, just simple and short, you had fluids during your labor and delivery. These fluids can make your breast swollen. They fill your breast and they call it third spacing. So that pressure in your breast prevent the milk from flowing down. So what you want to do is to massage your breast backwards. So if this is your breast, you massage it backwards like that, backwards. And that will push the fluids back and allow the breast milk to flow. Of course, skin to skin, keeping baby close, sniffing your baby. If your baby had to go because of an emergency, normally they will take a blanket or a napkin to the baby, and then they will bring it back to you. You can sniff and they take something from you to the baby and put it. That helps as well. Also, if you are not able to do skin to skin, your partner or spouse can do that skin to skin, and that should help. So the most important thing is that your milk is there. We just have to find a way to make sure that we let it come out. And so that space right there means so much, because everything happening is the hormones dropping. There are things that need to happen, stimulation of the nipples. All those things are necessary for your body to start doing what it has to do. So your body has to know, okay, I have to be making milk. I have to be making milk. And the way they know that is if the milk is removed and all those mechanisms are taking place. My baby cries. My baby cries. How do I know the baby is not hungry? So if your baby a baby cries because they have a need. So if they are gassy, they are hungry, they cry. That's how babies speak. And so sometimes we think that the only reason we should pick baby up is if they are hungry. But sometimes baby wants to be close to your body. Everything outside is new to them. They were inside your tummy where they were fed 24/7. They didn't have to, do anything special like lay in your arms this way, open their mouth that way. They are learning all these things. So in the womb was really cozy. The temperature was perfect. They were feeling you all the time, close to you all the time. And now they are in this world where it's cold or it's too warm or whatever that they have to encounter. So everything is new to your baby. There's gas, they feel gassy sometimes and all that. And so all these things are needs that baby has. So if the baby cries, you have to pick them up. And if it's within the time that you think they are hungry, you have to put them to your breast. If you think that baby is not hungry, you can try other comfort measures like burping them, trying to sing to them, trying to, hold them in your arms. They like to be held a lot. I promise you, you are not spoiling them. They will trust you, and as time goes on, they will learn to be on their own. It takes time. It's just that we don't have support nowadays. So we are really tired, and we are in a hurry to let baby sleep on their own, sleep in your crib. But baby just needs us. So if your baby cries, do not let them sit there and cry because you think they are not hungry. Pick your baby up and comfort them. Use all the comfort measures you can think of. You will never go wrong with the boob. A breastfed infant cannot overfeed, okay? Put them on the breast. If they don't want it, they will suckle for comfort. Yes, I use the breast for everything, pacifying, everything. And I have my peace, they have their peace. But of course, it's hard, like I said. So thank you. If I didn't answer something clearly, please let me know. Bye-bye.